Alright guys, we made a previous video about shin splints and medial tibial stress syndrome. And one of the things I did go over was the Friedrichsen classification system. And one of the interesting points about that classification system was that the first, had grade 0, which is completely normal on MRI, and then when you transition to grade 1, you're going to start to see a periosteal edema. And I think this is really interesting to note that this specific section is where you're going to see the initial stages, and why all of these sequential stages come after this initial stage. I think it's such a critical stage. There's a lot of really important stuff happening within the periosteum that I think kind of gets glossed over and people don't see and don't understand. So I want to talk about some anatomy of the periosteum, why it's so important in something like shin splints or medial tibial stress syndrome. But these principles, you can extrapolate them and apply them to all sorts of musculoskeletal pain conditions that involve the bone marrow edema, attachment sites, and a lot of these things have overlaps with the way that we treat with something called comprehensive prolotherapy. So I just want to talk about this for a moment. So heading back to the periosteum. The periosteum has two layers. It has an outer fibrous layer and an inner cambious layer. And important things to note, the outer fibrous layer has type 1 collagen fibers, blood vessels, and nerve fibers. And an important thing to note is that the nerve fibers in this area are very sensitive to pain. So if these nerves are constricted in any way, they can be generators of significant pain. So, maybe somebody has a stress reaction, but maybe they're not even on the Friedrichsen classification system that we talked about with medial tibial stress syndrome, but these nerves are being compressed. Assessing the periosteum is so important. So it kind of gets back to a good physical exam. And then moving on to the inner cambious layer. This is one of the points that's so important to note about how all these sequential steps happen after this layer is affected, because this inner cambious layer is a rich source of mesenchymal stem cells and progenitor cells. So if you don't know what those are, basically the precursor cells that can become other cells within our body. And we also have osteogenic progenitor cells, osteoblasts, and chondrocyte precursors. So these are all the cells that lead towards the good health of our bone and our cartilage, and they're present within that outer protective layer. So the periosteum is a layer that's just so important to the good function of our musculoskeletal system. And I think it's so important to assess it and even potentially provide therapeutics that address this specific area, because we can see the cascade of events that sometimes happen when you start to have dysfunction within the periosteum itself. So, all right, I hope that helped you guys understand a little bit more about anatomy and regenerative medicine.